I'm so glad that we're together today because you've been doing so much great research for the Dystonia community, but most importantly, the Department of Defense. They've begun to fund and recognize dystonia pretty much as a result of not only your great research, but the fact that the Dystonia Advocacy Network has been promoting every single year for the dystonia community get funding through the Department of Defense, which is remarkable.
Absolutely.
Can you tell me a little bit about how you've gone about getting the money and what they've actually funded for you?
Sure. So thank you for having me and letting me talk about the Dystonia grant that we got with the DoD. As you know, the DoD funds more higher risk projects that the NIH might not normally fund, and that's where we approach the DoD for funding. So you know that Artane can be effective for many patients, but not a lot of patients can take it because of the side effects.
Right.
And the side effects occur because Artane works at many different receptors, not only in the brain, but throughout the body. And the question is, the problem is, that we don't know which receptors are helpful for the treatment of dystonia and which ones cause the problems associated with the side effects. So what we proposed to the DoD and what they funded was a study to discover how Artane works in the brain and which receptors Artane works at to alleviate dystonia. And what we have discovered is really interesting. What we found is that Artane actually corrects the low dopamine problem in the brain of DYT1 mouse models. And that's important because low dopamine is seen in many forms of dystonia and may underlie dystonia across the board, right? And so to see that correction was very exciting to us.
That's incredible because I think in terms of my own family, my children were all on high levels of Artane that pretty much took away their memory, short-term memory, and made life miserable.
All those bad side effects. So the idea here is, now that we've discovered what Artane does in the brain, now we can start focusing on which receptors correct the problem, correct the low dopamine, so we can focus on finding drugs that target the problem, the low dopamine, but don't target the receptors that cause all those bad side effects.
This actually sounds very applicable to the dystonia community.
Absolutely.
Do you think this will be transferred into drug therapy or some therapy in the future?
So we're very hopeful about that. Part of this grant, actually, was to work with drug companies who supplied their new compounds that aren't yet on the market as drugs, but actually target these individual receptors in the brain. So we're often actively collaborating with pharmaceutical companies and academic researchers, right, to get new compounds. So we're very hopeful that in the not too distant future there will be some new drugs on the market.
So it sounds like the Department of Defense has really supplemented your funding mechanisms for dystonia research.
Oh, it has been a tremendous boon for us because we never could have done these studies without the Department of Defense funding. These studies were a little more high risk, weren't really sure which direction they were going to go, and NIH doesn't tend to fund those kind of studies, but the DoD is specifically geared toward having an impact not only on military personnel, but also on the general public, particularly their families. So that's what they're looking for. They're looking for these grants that have impact through therapeutics or some mechanism to help patients.
I'm so proud of you.
Oh, well, I'm proud of the DMRF for all you guys have done for advocacy.
Yeah, I'll tell you, Dan has worked diligently every single year to try to get dystonia back on the list, and we've succeeded.
Yes.
Ellen, we've brought in $12 million for dystonia researchers over the years. So I'm very excited, and the fact that our advocates come back with the passion to make this happen, and so grateful that you made application. Tell us about the most exciting thing that you just were invited to resubmit.
Oh, yes. So the DoD has a new mechanism, we call it in the grant world, where you can actually renew your grant. Previously, you got
That's
a 3-year
fabulous.
grant, and that was the end of the grant. But just this year, they introduced the renewal mechanism, and our grant
You
is
got
up
it.
for renewal. Well, we passed the first stage of the application process, so we're on to the second stage of the
That's
application
terrific.
process, so fingers crossed.
Yeah.
But it's a wonderful opportunity because it is by invitation only, so they really are targeting the grants that they want to see move forward, so we're excited.
Grateful. I'm so grateful to you for all the work that you do, seriously, and to give hope to the patients, family members as well. You've done a great job, and
Oh.
please continue. We
Oh,
need it.
we will. It's wonderful to hear those words because, we're really doing this for the patients. That's why we go into work every day.
Thank you.
Thank you.